I talked about that with Dr. Arthur Caplan of New York University's Langone Medical Center.
So one of the things we don't really think about with climate change and global warming is that pests, animals that trouble our crops and may attack us, get broader ranges. Mosquitoes, for example, like warm weather. They don't really like cold weather. There are plenty of mosquitoes bearing all kinds of diseases, yellow fever, Zika. We have dengue, chikungunya. And the more the climate warms, the more mosquitoes spread out. Similarly, other pests that attack fruits, vegetables, things we need to have nutrition, they're also enjoying the warmer climate. So these are real dangers. Pandemics, epidemics, people living closer to where disease-bearing animals or microbes might be, those are part of the health costs of global warming.
One of the things that I found interesting is I read this piece, you think of the plague, you think of this as this kind of a notion of past history, but they say changes in temperature and rainfall will impact rodent population as well as infected fleas that they carry, and this could be a very severe problem, once again, hitting us.
Right, so what we tend to do too much, in my view, is look toward the individual and say, well, maybe you have bad genes, or maybe your immunological resistance is low. But what we miss is that's missing the forest for looking at some trees. When you have more rodents, when you have deer expanding in their population, then ticks, lice, fleas, other parasites that go along with these animals start to have broader ranges. That's why the plague becomes an issue. That's why tick-borne diseases, as we see with Lyme disease in the United States, keeps expanding all over the place. Let's put it quite simply. Animals that threaten us, pests that threaten us, who ride on the backs of animals, they like it warm. They like the warm weather.
How do we mitigate these health issues?
Well, I think first and foremost, we don't want to blame the victims. We can't go around saying it's your fault that you didn't live a healthy lifestyle. It's your fault that you have bad genes. Look, if pollution is horrible enough, it'll overwhelm anybody's constitution. It'll make anybody sick. If the globe warms up, no matter how hard you try to exercise or jog or remain healthy, ticks, fleas, lice, other disease-borne pests, mosquitoes, they don't care. They're going to be able to attack your immune system and do harm as well. So really what we have to do is get focused on the environmental causes of disease, the way climate shapes those causes and expands them. That's our public health challenge.
So as you talk about the public health challenge, how do you see this playing out in the years ahead? And where do you see people in the public health field addressing their concerns at this stage?
Well, unfortunately, I still don't think we have the kind of strong international public health tools that we need. The World Health Organization is underfunded. They don't have a rapid response capability. If there's an Ebola outbreak or a Zika outbreak or a yellow fever outbreak, they can't get people there. They're not like the UN deploying troops. They don't have any people to send. We're not collecting data in a systematic way and sharing it sufficiently on what the impact is of climate change. So sadly, I think we've got a ways to go to really prepare ourselves for a changing environment.
If you like what you just saw, follow us on social media and visit our website, cctv-america.com.